What are Cetrotide and Ganirelix used for? So if you're doing what we call the antagonist protocol, the antagonist of your cycle is Cetrotide or Ganirelix. Again, these are just two different brand names of the same medications. They come in different ways to mix and inject. They have different needle types and things like that, but they are the same medication. They are both antagonists. Antagonists are used to keep all of your follicles together in a cohort. So we want them to stay together and grow together versus your body kind of going off and doing what it wants to do naturally, which would be that one, maybe two follicles kind of take the lead and go off on their own towards ovulation. So instead of allowing your body to do what it naturally does, the antagonist, so your Ganirelix or your Cetrotide, keeps your follicles from being ovulated and keeps them growing together in a cohort. When would you start your Cetrotide or Ganirelix? So typically a couple of days into your cycle is when they introduce the antagonist. So once your follicles start growing, so we see different sizes coming through instead of all of them kind of being bunched together in a small size, once we see movement in your follicle sizes, we introduce that antagonist, the Cetrotide or the Ganirelix, to keep them growing together. It depends how you progress. If you're a really quick responder, you might go in on day 3 or day 4 and your follicles have already started growing. And once we see that movement, then we have to introduce it so one doesn't go off on its own. So it really depends on your response to the medications. So like, let's say you first start with 10 on each side. Typically those 10 are, we label them as like less than 10 millimeters. Once we see that, okay, you have now, let's say you have 10 on each side, so 20 total. Let's say 10 of them stay in that 10 millimeter range, but we see that the other 10 have kind of started inching more towards 12 or 13. They're starting to actually grow and respond to your rise in estrogen. That's when we want to introduce the antagonist so that they're not going off on their own and everything can grow together. How are Ganirelix and Cetrotide administered? They're both subcutaneous injections, so we inject them subcutaneously, typically in your abdomen, sometimes the upper outer thigh as well, but that's the most commonly used spot is your subcutaneous in the fatty tissue of your abdomen. What are the side effects of Cetrotide or Ganirelix? Again, all of the IVF medications typically have the same side effects. So bloating, foggy headedness, cramping. Cetrotide has a little bit of a skin reaction associated with it. So some people get a kind of hives looking area at the site of injection. It looks like hives, it feels like hives, but it's not an allergic reaction. So a lot of patients actually do freak out and they panic and they think that they're having an allergic reaction to the medication, but it's not. It's a very common skin reaction. It can last anywhere up to 2 hours. But it does typically go away on its own and it does not signal an allergic reaction. The Ganirelix, the needle is a little bit tougher or less smooth as it goes in, so it doesn't go in as smoothly as the other injections, so you might feel a little bit more of a push when you're actually injecting, but that's the only thing that we see with that needle. There is no none of that hives reaction that we see with the Cetrotide.